guys, welcome to Counseling Talk. I am here with Dr. Tom Murray, who's actually in Greensboro. And aside from this video that you're watching right now, Tom and I have gotten to know each other. We've had coffee, which means that we like each other to an extent. So Tom, thank you for being here. Those listening, kind of share a little bit about yourself.
Well, thank you, Juan, for having me on your show. I am a sex and marriage therapist, like you said, in Greensboro. Have been a sex therapist for about 5 years. And prior to going into private practice, I was the director of a university counseling center. I had done that for 10 years and moved my practice into just working almost exclusively with sexual related disorders or concerns, and primarily couples. So it's been a wonderful and fun, exciting transition.
That's awesome. Which school were you a professor at?
I was at Northwest. When I was the counseling center director, I was at UNC School of the Arts.
Okay, cool.
And then, but I've taught at like Northwestern University. I teach their sex therapy and their family therapy courses most recently, which is fun. I love my graduate students.
I bet those are some fun classes. I wanted to have you on here because, you know, myself as a clinician, I work with couples. I know you work with couples. And sometimes the topic comes up of sex therapy, or a patient may say, you know, he's way up here or she's way up here on level of arousal libido, and I'm here. And from my end, at least as a clinician, I think most couples or relationship clinicians, we try to approach it, you know, Gottman or in a holistic manner, in a supportive, let's communicate, let's approach it constructively. And maybe you're over there and you're like, yeah, that's good, but this is what we should do. So someone that's going to struggle with the area that you're going to focus on, what's that individual like? What's their profile like?
I think a lot of, like you just laid it out, a lot of clients come because they have, they have discord within the relationship around sex and sexuality. Often they come in with the idea of, we're not very good at communicating. You know, we need to be able to communicate better. And, a lot of therapists really reinforce that idea of, how do we help you to become better communicators? As sexual health professionals, we recognize that better communication often doesn't lead to better sexual life. In fact, we hear all the time people who have terrible communication and wonderful sex life. So this whole idea that they're one and the same, or they directly lead to the other, we recognize is often not the case. And so,
wow,
a big part of my work is sex education, helping people to understand the varieties in which people express their sexuality, and then to develop mutual respect around how each other expresses their sexuality. And quite frankly, I find that men have a lot to learn as it relates to sexuality, not only for themselves, but also for their partners, particularly if they're in heterosexual relationships. If we talk about the LGBT community, there are a lot of similarities, but there are also a lot of differences. So kind of within that heterosexual community, there's a lot of education to be done.
Wow, that's a mouthful. Now, whenever you're looking at sex education, I probably went in the wrong direction. We're not talking about middle school sex education where it feels
sometimes we are, Juan.
Oh, sometimes we are. Okay.
I mean, when I draw a clitoris on the pad, and I often like, what is both men and women have a hard time identifying it.
I can
now,
see
you
that.
might think, oh, if I've seen a vulva, I've seen a clitoris. But for example, the clitoris is actually shaped like these, these four fingers with these clitoral bulbs and clitoral legs. And then what we see is the clitoral head, right? But when I draw that, people don't know what that is.
Yeah, people are like, is that Avatar? What's going on here, Dr. Murray? I
Yeah.
love how soft you are when you approach it. I was just thinking about myself because, I'm a Hispanic male born in the Dominican Republic. So sometimes that subject can be a little bit challenging, but you threw it on the table in a very nurturing like manner.
I try. It's a lot of people come in with a tremendous amount of shame, of guilt, of these childhood messages around sex and sexuality being wrong, being dirty, or quite frankly, a lot of people have experienced their own trauma around sex and sexuality, and that legacy is brought into the counseling room because it's been echoing through their relationships. And so, I think what is particularly helpful about seeing a sex therapist is that we're exposed to such a variety of issues related to sex and sexuality that we're generally unfazed by that diversity. In fact, part of the training of sex therapists is to do what's called a um, sexual assessment reevaluation, I think, or SAR. I can't remember what the acronym means, but
Hmm.
it's being exposed to just the diversity of sexuality so that the therapist can identify um, where their triggers are,
Yeah.
right? So that it doesn't become a trigger in the counseling room.
Almost like an immersive experience.
Yes, yes.
Yeah, I remember that uh, back in the day of breaking into some textbooks or being pushed to go into the community in certain environments.
Yeah.
Now, when you're working with, let's say, a couple and they're coming in, maybe they're sharing that they had a really rough past relationship where sex was just, I don't know, the worst. So now they're struggling, or, messages connected to upbringing. What are some, just off the back support recommendations that you provide to get them going in the right direction?
With couples who have had a history of what I call domestication, in which it leads to this restricted view of sex and sexuality, I really coach them to develop their own philosophy, their own style. What is it that they want to be able to say about themselves relative to their own sexuality, that is then a co-creation between them and their partner. So rather than relying exclusively on these messages, they're given an opportunity to identify, well, what part of my childhood teachings do I want to bring into adulthood? And what is the rest that I want to leave behind so
Hmm.
that I'm
Yes.
more fulfilled in my sexual relationship?
I love that. So you're giving them like this level of empowerment. They're coming in and, here's where I'm at, here's a struggle where I want to get to. And then we're going, okay, let's unlearn, which is a process, a journey, and then let's pull what's comfortable for you, which I think is great when it comes to sex.
Yeah, I mean, we can look at masturbation, for example.
Let's do it. Let's look at it.
I
We're gonna pull a video up of it while
I
we talk about it. No, no, let's not do that.
actually, in fairness, just being self-disclosing here, when I went through the SAR, I was pretty comfortable with just about everything they were throwing at me. But the thing that I was surprised by my own, like, oh, I shouldn't be watching this, was your everyday person masturbating. Like, if I've seen like on a porn video, someone masturbating, that was, it just felt different. But just your average person doing it, I was like, oh, I shouldn't be watching this. This is it, you know.
Yeah.
So anyway, um, with um, with particularly women who have trouble with orgasming, or what's also known as anorgasmia, um, often they've just never developed a self-pleasuring practice that helps them to learn about their own orgasm. You know, women, of course, I've never been a woman, but what I understand is that process is one of learning how to have an orgasm versus, you know, men. It's takes much less of that learning to happen. You know, evolutionarily speaking, it should not be
Yeah.
that, you know, challenging, although of course there are men who experience premature ejaculation or delayed ejaculation, and we can talk about those things. But for women, often the limitation to masturbation isn't inherent. It was learned. Oh, that this is something I shouldn't do. This was wrong. This is bad. And helping them to take ownership over their own bodies rather than believing that their body somehow belongs to a patriarchy or religion, etc.
Yeah. So again, empowerment again, right? Like you're owning your space.
It's a big piece of just well, I use the term, and we may have talked about this when we met for coffee that one time, but I really value the term self-aside. That sometimes we commit self-aside to go along, to get along, and essentially that means the cleaving away of important parts of ourselves until we have no sense of who we are as authentic beings.
Yeah.
And so the antidote to self-aside is self-fullness. Self-fullness, not to be confused with selfishness, but self-fullness, this idea that I can fully embody this space, that my needs, wants, and desires are just as legitimate, right, by virtue of my existence here. And retraining and relearning is a big part of that movement towards self-fullness.
I like that. You connected very well and provide like this framework. As I'm hearing it, I see both sides and I see what I want to do and where I want to get to, and I really appreciate that. Even if as I'm listening to it, here's something that comes to mind. It reminds me of, I guess, an aspect of the 5 love languages. You know, Gary Chapman, all his love languages there. In case you're listening and you're not sure about the love languages, you basically got these 5 love languages, and each one of us relate to a certain one to a higher extent. And something that I try to do is I try to get people to just feel really comfortable to acknowledge, hey, my highest one may be words of affirmation, and yours, my partner, my wife, your highest one may be gifts, right? Now, if we're able to approach it in that way, it can increase the level of comfort to providing that person with what they're looking for. So I wanted to ask you, are there challenges that you experience where a couple may come in and there's like that polar opposite, right? Just 2 different love languages, but more about sex, maybe arousal, libido, and you're trying to develop a compromise, an understanding, a balance. How do we support each other?
Yeah, that low frequency desire or frequency discrepancy is, again, one of the more common presentations that a sex therapist will see, and counselors, as you mentioned, you've had couples who talk about this discrepancy, and when we take time to peel it apart, we discover that there are some underlying messages there. So, for example, there's essentially 2 types of desire. There's spontaneous desire and responsive desire. And spontaneous desire is the one that we most associate with male sexuality. This sense of I can, for whatever reason, the thought of sex comes into my mind and I'm ready to go. I want to have sex, right?
Yeah.
Responsive desire is my desire for sex depends so much on what's going on in the space around me. So if there's discord at home, if there's pressures at work, if there's dishes in the sink, if there's, kids crying in the other room, if there's a lot of clutter going on in here,
Mm-hmm.
that really can impact the interest in sex. So again, spontaneous and responsive. Unfortunately, in our culture, we privilege spontaneous desire.
Yeah,
And
I
we
was
say
thinking
that
that.
if you don't have spontaneous desire, then somehow your desire is broken.
Yeah, you don't love me, you don't care about me. Yeah.
Right. Or there's something wrong with you.
Mm-hmm.
It can be as explicit as that. And so often women will come in with this idea of maybe there's something wrong with me. And what I try to educate men is often when there is this sexual frequency discrepancy, it's because they've made having sex too expensive.
Too expensive.
Too expensive.
I know we're not
Meaning,
talking about money.
we're not talking about money.
Share it with
But
me.
so what I mean by that is for a lot of women, and again, we're all, I'm being very heteronormative here. But for a lot of women, the idea is, well, you seem disinterested in me throughout the week, and then it's just the weekend, and now you want to have sex. But there's a lot that has to, there's a lot that has to happen in order to have sex with you, right?
Yeah.
There's a lot of just, a lot of clutter inside or outside of the in the house and in my work life, etc. So if you're not going to help me and I'm going to reward you, then it's too expensive. I'm not willing to have sex with you because the cost of it would be too expensive. So men can do a lot to decrease the cost of having sex. And we call that foreplay. And foreplay begins immediately after sex ends.
I got it. Yes.
Right? So it's
Yeah.
all of the things that a partner does throughout the week that shows I care about you, that you're important to me, right?
Yeah.
That I yearn to want to make your life easier. And when all of those contexts are put into place, you naturally find that arousal goes up, that interest goes up.
Tom, I am mind blown. You know your stuff so well. For so long, my interpretation of foreplay was, I guess, what I've learned through, K through 12, or at least through the books that I was given and I approach. Foreplay, we're kissing, we're making out, or oral sex, maybe, things of that nature.
Right.
But what you're speaking of goes beyond that. And it makes sense. It reminds me of sessions that I've literally had in here where people are sharing that, I feel that we're stressed, or, you only grab my ass, but I want you to hug me longer or check in on me. And just like you're saying, all of these connect to like this bucket, right? Fill the bucket up, and then we get to meet there.
Yeah, when couples come in, I'll often say, let me guess what your sexual ritual is. Nipple, nipple, pussy. And the head starts shaking. That is like the extent of it. And or what the other thing is that in order to have passion, you have to have mystery. And you have to have excitement. Too much of the American life is predictable. There's this constant drive towards comfort and familiarity. And as a consequence, that sucks passion and desire out. So you need to have passion and desire. So where I was going with this is that I'll often ask, What percentage of the time when you have sex, do you have sex in the bedroom? 100%.
Yeah.
Well, then stop. You have a whole house, right? Create some, new experiences. It's through these new experiences that you build excitement and you build passion. If it's the same thing over and over and over again, it's soul sucking.
A moment of silence on the importance of that statement there. We are going to take it. You're right. I'm going to go home and apply some of these today, Dr. Murray.
Good. I'm so glad to hear.
You truly are. You know exactly what you're talking about. You comprehend the content from one clinician to another. I mean, I share with you when I work with couples, it doesn't connect to that degree of sex therapy, but everything that you're saying are comments that I hear back here in the office, and I'm approaching it in a different manner. I'm not going to say incorrect manner because it's what, education and schooling has taught.
Sure.
But then there is your realm, and that one integrated, in here, it would have led to maybe a higher level of success. So I'm going to be throwing a lot of people your way so that we can work on that high number of divorce rate. You and I are going to work together to drop that number down.
I hear you. That sounds exciting.
Tom, it has been amazing having you on here. I could talk to you for hours. I mean, there's so much I want to ask about sex therapy, about the work that you do. So maybe we'll connect and see if we can't do this in the future. If there are people in our community and they're like, I want to work with Dr. Murray, I want to figure out, how he can help. How can they connect with you?
They can go to my website at drtommurray.com. That's drtommurray.com.
All right. And I did some side stalking. So all I had to do was Google sex therapist in Greensboro, and Tom Murray, Dr. Murray came up right away. And he's got this awesome YouTube video that kind of gives you a nice introduction to who he is. So yeah, if you're out there and you want to be able to move your relationship in the right direction in connection to couples work, sex therapy, he's got my endorsement.
Thank you so much, Juan. It's been wonderful being on your show.
Absolutely. Have an amazing day.
Bye now.